Hello and welcome back friends. This is part 3 of the tummy tuck series that we have made for you, and in the first two parts I've explained about what things you need to take care of before the tummy tuck surgery, and in the second I've told you about the surgery itself and what are the things you should expect after the surgery and how the recovery would be like. And this video is on the risks and complications of tummy tuck surgery. If you have not watched the earlier two videos, the link is above, you can go and watch them. And this video is for the risk and the complications of tummy tuck surgery. Hello friends, I am Dr. Ankit Gupta. I work at Panache Hair Laser Plastic Surgery in New Delhi, India, and this is part 3 of the series of tummy tuck surgery, and the video is on the risks of or the complications of tummy tuck surgery. So the most common thing that patients asks me are about the scar, which we have already explained in our previous video. The most common complication or the problem that we see is sometimes of seroma. So seroma is a fluid collection that can happen, and usually we try to prevent it by putting drains, and that is why I prefer to put drains for at least 3 to 4 days after your surgery, and so that all the fluid that gets accumulated are sucked out of the drain and the seroma is visible. Okay. Also, that after the surgery, if you do not exercise too much and if you do not exert too much and you wear your pressure garments properly, if you wear them properly, the chances of seromas are less. Fine. The next is what is the risk of blood clots after the surgery? So to prevent the risk of blood clots, I would recommend you that you stand on the very same day of your surgery. Usually these days, we recommend wearing that DVT pumps intra-op as well as in the post-op period while you are not walking, not going around. But if you are able to get up from your bed on the same day of your surgery, the chances of deep venous thrombosis or blood clots reduce significantly, and from the day 2, you are supposed to walk around at least for 2-3 minutes on the day 2 for 4 to 5 times a day, so that the blood does not get clotted in your legs and is pumped regularly. Keep moving your legs, wear DVT pumps, wear DVT compression stockings and all those things to prevent blood clots. Okay. Will I need a blood transfusion during the surgery? Usually no. Tummy tuck does not cause a significant amount of blood loss, and you do not need blood transfusions if your hemoglobin level was more than 12. If you combine a lot of surgeries together, then you might need one, but I usually prefer not to give any blood products to my patients and try to build up your hemoglobin before the surgery instead of giving you blood product. How long will the results of tummy tuck last? So the results would last your life. You do not have another baby or you do not get pregnant again, the results of your tummy tuck would last. But if you gain a significant amount of weight or you become pregnant, only then the results of your tummy tuck will get. So it is that you will gain new skin and you might get another muscle diastasis, and till the time you do not gain a significant amount of weight or you do not get pregnant again, the results would last. Can I regain abdominal bulging after surgery? No, you will not regain the bulge, because you have, if once we stitch the muscles together, it will not get separated until you become pregnant again. Is there an ideal age for tummy tuck surgery? The ideal age would be after you have completed your family, only then you should get a tummy tuck surgery. Can tummy tuck surgery help with back pain and posture? Usually no, but yeah, if somebody has a lot of gap in their muscles and the contents are coming out, once we put the contents back in and then we close the muscles in front, it can help you with your posture and all. When can I travel after the surgery? You can travel, so traveling, by traveling if you mean air travel or going out of the city, I would recommend stay in Delhi for at least 2 to 3 weeks after your surgery, and then only you travel to distant places. When can I fly back after surgery? Ideally not for 2 weeks, and after 2 weeks only. Will I need a scar treatment after surgery? Usually no, you don't need a special surgery for your scars, but I would recommend you put silicone tapes over the scar to make it better, so that the scar is less and less visible, and if you can, maybe try CO2 fractional laser to make it less visible if you have if you are brown and if you don't have a very nice scar. Okay. Can revision tummy tuck surgery be performed? Yes, tummy tuck surgeries can be revised if not done properly in the first time, or if you had a baby again, or if you have gained a lot of weight. Tummy tuck surgeries can be revised. What factors affect the cost of tummy tuck surgery? The cost of the tummy tuck surgery would depend on the amount of fat you have, how much sagging you have, the kind of tummy tuck surgery being done. Is it a mini tummy tuck, extended tummy tuck, or a standard tummy tuck? Is liposuction combined or not? Are we putting fat in your bum or your breast areas, are we combining other surgeries or not? Then it would depend on the days you stay in the hospital. If you are opting for an epidural anesthesia along with the normal general anesthesia, it will also depend on the doctor who is operating on you, what is the qualification of the doctor, as well as the center where you are getting operated. It will also depend on the brand value. If you are getting operated in a very big corporate hospital, the cost automatically gets increased. If it is a doctor-run center, the cost is usually less. It also depends on which city, because the cost of the surgery and everything also changes with the city that you are getting operated in. So guys, I hope with these 3 videos, I have answered most of your queries on tummy tuck. And if you have any more questions, you can always drop a comment in our section below, and I'll be happy to help you. Thank you and have a nice day.